Hi. In this session, we are going to discuss the projections, radiographic projections. What is an AP projection? What is PA projection? What criteria we are giving name to a projection? So we are giving name for a projection based on the entrance and exit point of the central ray. We'll be giving name for a projection based on the entrance and exit point of the X-ray. For example, antero-posterior AP projection. Antero-posterior projection means central ray, CR, central ray enters through the anterior part of the patient body and it exits posterior side of the X-ray, a patient body or part. And PA projection, posterior-anterior projection means X-ray beam enters the posterior surface and exits through the anterior surface. So based on the entrance and exit point of the central ray, we are determining the projection. So in this session, we are going to discuss the routine and special projections. We'll be discussing what is an AP projection, what is a PA projection, what is a lateral, what is AP oblique, what is PA oblique. In AP oblique, we have discussed right posterior oblique, left posterior. In PA oblique, we have discussed right anterior oblique, left anterior oblique. Then axial, AP axial, PA axial, AP axial oblique, PA axial oblique. Then we have discussed some special projections also. So we'll start with the easy one, AP, antero-posterior. So antero-posterior means, as we discussed, central ray enters through anterior surface and exit posterior surface of the part or body. If the central ray enters through the anterior surface of the patient and if it exits posterior surface of the patient, it is called antero-posterior. Then what will be the PA, posterior-anterior? Central ray enters through posterior side surface and exit through anterior surface of the part or body is called posterior-anterior. AP, antero-posterior, is central ray enters through anterior surface, exit through posterior surface. Posterior-anterior means central ray enters through posterior surface and exit through anterior surface of the part or body. So we are determining the projection based on the entrance and exit points of the central ray. Is that clear? Yes. Next. Then what will be the lateral one? Lateral is simple, very simple. Just central ray enters the lateral surface and exit through the opposite lateral surface. Central ray enters the lateral surface and exit through opposite lateral is called true lateral. True lateral is nothing but perpendicular central ray enters the lateral surface of the body and exit through the opposite lateral surface of the body is called true lateral. We have medial lateral, lateromedial is there, that will be discussed later. Okay, is that clear? Yes. Now we are going to discuss the oblique projections, AP and PA oblique. Keep in mind, oblique is nothing but rotated part or body. Oblique implies if the patient is rotated or the part is rotated, then we'll call that projection as oblique. So keep in mind, oblique is nothing but if the part or body is rotated, we can call that projection as oblique. Clear? Yes. So AP already we have discussed. Central ray enters through anterior surface, exit through posterior surface. So AP oblique means rotated part or body. AP means central ray enters through anterior surface, exit through posterior surface. So AP oblique means if the patient is rotated and central ray enters through anterior surface and exit through posterior surface is AP oblique. Rotated part or body and the X-ray beam enters through anterior surface, exit through posterior surface is AP oblique. Then PA oblique is oblique, patient is rotated. PA, central ray enters through posterior surface, exit through anterior surface is PA oblique. So keep in mind, oblique means rotated. So AP oblique means rotated. We are giving 7 central ray enters to the anterior surface and exit to the posterior surface of a rotated part or body. It is called AP oblique. If the central ray enters the posterior surface and exit through the anterior surface of a rotated part or body, it is called P oblique. I think it is clear. Oblique means rotated. Then we have right anterior oblique, left anterior oblique, right posterior oblique, left posterior oblique. What are those projections? Right anterior oblique, left anterior oblique, right posterior oblique, left posterior oblique. See, in a right anterior oblique, they just mentioned about the anterior, no posterior. So we cannot say whether it is an entrance point or exit point. So we are keeping that law aside. Then we have to understand if it is a RAO projection, then we have to understand that RAO means patient's right anterior side, right anterior front side is contact with the image receptor and patient is rotated. If the rotated patient's anterior right side is contact with the image receptor, then it is called right anterior oblique. Then what about LAO? If the patient's left anterior part is contact with the patient and the patient is rotated, it is called left anterior oblique. Then what about right posterior oblique? If the rotated patient's right posterior back side is contact with the cassette image receptor, it is called right posterior oblique. If the rotated patient's left posterior oblique, left posterior part is contact with the cassette image receptor, it is called left posterior oblique. So in those situations, if they doesn't mention entrance and exit points, just mention either anterior or posterior, then we have to understand that they are mentioning about the part that is contacting with the cassette. Clear? So then tell me, what projection is this? This one. This, whether it is a right anterior oblique or left anterior oblique or right posterior oblique, left posterior oblique, it is a right posterior oblique because the right posterior part is right back side is contact with the image receptor. So it is a RPO, right posterior oblique. What about this? This one is left posterior oblique because left posterior part is contact with the image receptor. So it is a left posterior oblique projection. Then what about this here? Right anterior part is image receptor, contact with the image receptor. So it is right anterior oblique. Here, left anterior part is contact with the image receptor. So it is left anterior oblique. Is that clear? So under AP oblique, we have RPO and LPO, right posterior oblique, left posterior. Under PA oblique, we have right anterior oblique, left anterior oblique. Yes. So this is a true AP projection. Posterior side is contact with the receptor. X-ray beam enters to the anterior surface, exit to the posterior surface. PA projection is X-ray beam enters to the posterior surface, exit to the anterior surface. Right lateral means X-ray beam enters to lateral surface, exit to lateral surface, and the right side is contact with the image receptor. Left lateral means X-ray beam enters to the lateral surface, exit to lateral surface, and left side is contact with the image receptor. Clear? Left posterior oblique means patient's left posterior back side is contact with the image receptor and the patient is rotated. Right posterior oblique means patient right posterior back side is contact with the image receptor and patient is rotated, right posterior oblique. Left anterior oblique means patient's right anterior side is contact with the image receptor and patient is rotated. Right anterior oblique means patient's right anterior side is contact with the image receptor, patient is rotated. So clear? Oblique projection means rotated projection, rotated part. I hope it is clear. Now we are moving on. Now we are going to discuss the axial projection. So oblique means rotated. It is clear. Now we are going to discuss axial projection. Axial means nothing but angulated projection. If you are giving an angulation of central ray greater than 10 degree, those projections are called axial. If you are giving an angulation greater than 10 degree, those projections are called axial projections. So axial projections are the projections we are giving angulation greater than 10 degree. Clear? So axial means angulation greater than 10 degree. So AP axial means if an angulated central ray enters through anterior surface and exits through posterior surface, it is called AP axial. Axial angulated. AP central ray enters through anterior surface, exits through posterior surface. That is AP axial. Clear? Then PA axial is nothing but central ray enters through posterior surface, exits through anterior surface, and it is angulated projection. So axial means angulated. PA means central ray enters through posterior, exits through anterior. So PA axial is angulated central ray enters through posterior surface, exit through anterior surface. Clear? Yes. Then AP axial oblique, PA axial oblique. Already we have discussed oblique means rotated part or body. Axial means angulated projection. AP means central ray enters through anterior surface, exit through posterior surface. So AP axial oblique means an angulated projection enters through anterior surface, exit through posterior surface of a rotated part or body. Then PA axial oblique means oblique rotated part or body. Axial angulated projection. PA central ray enters through posterior surface, exit through anterior surface. So PA axial oblique means an angulated projection enters through posterior surface and exit through anterior surface of a rotated part or body. That's what PA axial oblique. Keep in mind, obliques rotated part or body. Axial angulated projection greater than 10 degree. Clear? Yes. Now we are going to discuss some special projections. Axiolateral, transthoracic, tangential view. Axiolateral. Lateral means central ray enters through lateral side, exit through opposite lateral. Axial means angulated projection. Just now we have discussed. So axiolateral means angulated central ray enters through lateral surface, exit through opposite lateral surface. Transthoracic. So axiolateral is clear, right? Lateral enters through lateral surface, exit through opposite lateral. Axial angulated projection. So axiolateral means an angulated central ray enters through lateral surface, exit through opposite lateral surface. Clear? Yes. Next one is transthoracic, simple projection. We cannot be called as a routine as complex projection. It's very simple. It's not complex. Still, transthoracic is nothing but central ray passes through thorax. That's it. Central ray passes through thorax is called transthoracic. Clear? Then, next one is tangential projection. Tangential projection is nothing but, just listen carefully, tangential projection is the projection we are using to project curved surfaces. To project curved surface, example, patella, the knee joint, or scapula, from the surrounding structures without superimposition or overlap. So tangential projections are the projections we are doing to project curved surfaces without superimposition from surrounding structures. So tangential projections are projections that are done to visualize or project the curved surfaces without superimposition of curved like surrounding structures. Clear? Yes. So axiolateral angulated central ray enters through the lateral surface and exit through opposite lateral. Transthoracic passes through thorax. Tangential view, central ray skims curved surface of a part to project it from free of superimposition. Clear? Yes. Next, plantar-dorsal and dorsoplantar. It is nothing but plantar surface means plantar means sole of the foot. Inner part, under part of the foot. Under part of the foot is called plantar surface. Dorsal means superior part of the foot. So plantar-dorsal means central ray enters on the sole of the foot and exit through the dorsal surface. So central ray enters through plantar surface, exit through the dorsal surface is plantar-dorsal. It is clear, like no complications. Dorsoplantar means just opposite, central ray enters through dorsal surface, exit through plantar surface, or routine AP kind of construction. Plantar-dorsal means central ray enters through plantar surface, exit through dorsal surface. Dorsoplantar means central ray enters through dorsal surface, exit through plantar surface. Clear? Yes. Then lateromedial and mediolateral. True lateral is central ray enters through lateral surface, exit through opposite lateral. Then lateromedial means central ray enters through lateral surface, exit through medial surface. Mediolateral means central ray enters through medial surface, exit through lateral surface. Clear? So based on the entrance and exit points of the part or projection. Clear? Yes. Then axiolateral oblique. Oblique means rotated part or body. Lateral means central ray enters through the lateral surface, exit through opposite lateral. Axial means angulated projection. So axiolateral oblique means an angulated projection enters through lateral surface and exit through opposite lateral through a rotated part or body. Axiolateral oblique means oblique rotated part or body. Lateral, central ray enters through lateral surface, exit through opposite lateral. Axial, angulated projection. So axiolateral oblique means central ray enters through lateral surface and exit through lateral surface of the patient, rotated patient, and this is angulated. Clear? Then submendo vertex view. Submendo vertex view is nothing but mendum means the inferior portion of the mandible is called mendum. This portion, inferior portion of the this is the mandible. We have a mandible body here. Mandible body, mandibular ramus, and this portion is called mendum. And this skull superior portion is called vertex. So if the central ray enters through the mendum and exit through the vertex, it is called submendo vertex. Usually we'll be doing with the neck hyperextended. For the skull view, submendo vertex view, central ray enters to the mendum, inferior surface of the mandible mendum, and exit through cranial surface, cranial vertex. It is called submendo vertex. We'll be doing by hyperextending the neck by keeping the cassette, like or the vertex should be touching the cassette. Submendo vertex. Central ray enters the mendum of the mandible, inferior part of the mandible, and exit through the vertex of this cranium. Clear? Yes. Next is craniocaudal. Craniocaudal is nothing but central ray enters from the cranial surface, exit through caudal surface. Craniocaudal, central ray enters cranial surface, exit through caudal surface. Inferior superior, central ray enters through inferior surface, exit through superior surface. Superior inferior, central ray enters superior surface, exit through inferior surface. Clear? Yes. So these are the special and routine projections in the we need to know regarding X-ray projections. Routine and special projections. I hope it is clear. Thank you.